if a patient was to query or question the price, that's predominantly comes down to not fully understanding what the procedure is offering. It's going to deliver instant relief. It's going to benefit the patient tremendously more than maybe their at-home treatments are delivering. Plus, if they're using at-home treatments or products, how effective have they been? How much money are they spending on those at-home treatments? And that ZEST, again, just to go over the benefits that ZEST will deliver. As I say, the only reason one of the reasons a patient would say that they feel it's too expensive is that they're not valuing the procedure, and that comes down to explaining the benefits.
Yeah, I think you're right. I also would add in there a little sentence about if I wouldn't be recommending this procedure if I didn't feel as though you needed it. I think is a really powerful message, because you're the ones who have identified the problem. You know, it's not the patient's irritation levels, because as we all can appreciate, they vary, and maybe there's signs before symptoms, often associated with blepharitis and Demodex infestations. Or it could be that the pain receptors, so the nerve endings, have become damaged and desensitized due to dry eye disease. And it's our duty of care, again, to turn them back on. So when a patient might say on a questionnaire on a scale of 1 to 5, how bad is it? Well, they think it might be a 2, but clinically it's probably a 4. It's just that they've become desensitized, and it's then our job to get them turned back on.
Just to add on to that point, that I think that's why it's so important to use imagery on the OTC machines. You know, the befores for any asymptomatic patients or mild patients who, you know, think that they're not symptomatic enough for £150 treatment. But then when you show them the image of the Demodex or Bleph, whatever it may be, and you know they squeal at it and want the treatment. So then obviously the same goes for the after photos, and maybe even one on the 6-month check-in or the 3-month check-in, whatever it may be.
The main thing about why it's different to just a drop is that, well, there's 2 things. You know, how often is a patient actually applying those drops, and how effective are they seeing that relief? So when a patient goes on this dry eye journey, they're starting at the bottom. So their relief starts to come up because they've applied a drop or a compress or used some wipes or hypochlorous spray, whatever it might be. So their pain or their relief has come up, and then they think, oh, great, I feel amazing. I'm going to put that hot compress in the drawer. So they've gained relief, which means, oh, well, I'm fixed and I don't need to worry about it. It comes up in relief and then comes back down. And then you might reach for it again. And that's typical every dry eye disease sufferer. The thing with ZEST is we don't take, this is base, we put ZEST up to the top. So now this is the ceiling. So this is what your eyes should really feel like. Okay? And everyone forgets that. No one realizes what their eyes should feel like until after a ZEST procedure. Now they're up here. What happens is, as that 6-month, or you stop brushing your teeth, i.e. not using at-home maintenance as well as you should be, is your relief starts to dip. So now instead of it coming up like before, it's coming down. And as soon as it comes down, that's when you intervene, because now you remember how your eyes should feel. And you intervene to bring the patient back up. And that's why ZEST will last 6 months. And that's why it's worth £150 plus.
ZEST offers clinicians, businesses and patients is enhanced compliance when it comes to at-home products. Patients are dispensed drops, lid wipes and compresses, which, as Sam said, that at certain stages patients go, oh, that's fine and I won't use it anymore. They'll only use it as and when the pain reoccurs or discomfort reoccurs. What ZEST enables patients to do is to have that newfound level of comfort, that newfound level of satisfaction. And it's that stage, that new level, that patients are not going to want to lose. So clinicians can, with some sense of satisfaction, say to a patient, and with ease, say to a patient that after the ZEST procedure, I'll pair you with your personalised at-home care plan. So part of the introduction of ZEST, as Sam said, I recommend is very important, using non-alarming language, referring it to the dentistry model that normalises costs, fees, normalises the importance of lid care as it does with gum care or teeth care. And that through that process, every clinician should say, and the cost of the procedure is X amount, and included in that procedure time, I will book out a 25-minute appointment. In that time, you will have the procedure. We will have checks that the procedure is going well, and that your whole exfoliation and procedure of cleaning and debriding or exfoliating your lashes and lids are being done as effectively as it can be done by a clinician. So I think if I could have if I could share any insights, it would be confident in yourselves, be confident in the product. It's extremely well received. It has a phenomenal success rate. Just value yourselves, value the product. Patients response or reaction when you get it as a wow will make you feel like $1 million. And when you get your first wow, that feels great. You can't wait to do other procedures. It's that great for the patients, and it makes you feel brilliant when you've done something for that patient. Pain and discomfort to give them a whole new level. So I'd say just fit the patients in as soon as possible.